I didn't mean it that way. You know me better than that. You took that out of context, and I think you're being a little too sensitive. You ever been part of a conversation like that? Perhaps you were the person that was hearing those words, or perhaps you were the person saying those words. I confess, I was the person saying those words, and that's what we're going to talk about a little bit here. How we need to understand and see those moments of denial that are impactful. We need to stop, we need to think, and then we need to act to move away from denial and into impact. So as I was saying, I experienced one of those moments of denial myself in a pretty public setting. I've been in community affairs for about 15 years. Started out as a community organizer in the south side of Chicago. Now, as I was introduced, I work as a director of hospital programs for two of Advocate Aurora Health sites, Good Shepherd and Condell. And that gives me the opportunity to work with a lot of different organizations, support a lot of different organizations. And over the 15 years, I've done a whole lot of these. The gala, the fundraiser, what I affectionately call the chicken dinner. Hopefully some of you out there have been there. I know that some of my colleagues here have certainly been. If you haven't been, really it's an opportunity to support a particular organization, and quite frankly also to connect with some of your colleagues, and for me in a work setting, in a more personal level. Usually you're there to break bread, have dinner or lunch, but what happens before is what everybody likes the best. It's the networking part. And in that networking part, usually you go grab a drink, and then what happens? You end up in a circle with all of your colleagues, talking again a little bit more personal about your life and what happens. Most of the time, the people that come to these events are the same people from your organization, and I happen to be at one of those events. And at one of those events, there was a couple of people that were new to the team, but there was a gentleman there that I've been to a bunch of times to an event, and I knew that he was gay. So I went up to him. He was about 2 people down from me, and I said, "Hey, where's your boyfriend?" And he stopped and he looked at me puzzled. And he said, "What do you mean, my boyfriend?" And I said, "Well, you know, the guy that you brought to the previous event." He stopped and he said, "Oh, that wasn't my boyfriend. That was just a friend that happened to be passionate about that particular organization." About a half an hour later, we both stepped away from the table, and I went up to him, and I said, "Hey, I noticed you gave me a look, and I noticed the answer you gave me," and he said, "Yes, Rafael, you put me in an unsafe space." Well, not all the people around that circle knew that I was gay. And I felt unsafe at that moment. My immediate reaction was, I didn't mean that. You know me. I had to stop, I had to think, and then I had to act. Because the reality was, my intent wasn't the impact that I made on his life. He felt unsafe. The denial for me was very easy. Why? Because I wasn't the version of myself that I wanted to be. I had put a colleague and a friend in an unsafe place. You can see how it's easy to get there. It doesn't match the idea that we have in our minds of ourselves. So denial can be a place in a public setting that you can get to very easily. And sometimes that can creep into other spaces. Perhaps into home. As I've told you, working in community affairs for 15 years, I can't tell you the amount of organizations that I've interacted with that give me a lot of education, trainings, incredible speakers, and so many different ways that I've been taught and trained on a number of different incredible topics. One of those topics happens to be mental health and suicide ideation, and I was taught by a wonderful local organization called Be Strong Together. I was fortunate enough to be part of their board, and as a board member, I took a training. And I remember being so excited about this training. I was going to share what I learned with all my friends, with my colleagues, with other organizations, with everybody. And I was so glad that I was not going to have to use that in my own home. Well, guess what? Last year was a very difficult year for many people. And a member of my family approached me and said, "I'm thinking of killing myself." At that moment, I had to make a really really impactful decision. Was I going to keep denying that suicidal ideation and mental health was not a part of my own home? Or was I going to go to impact? Because of the training that I took, I decided to go to impact. And I decided to ask 3 questions that I knew I needed to ask. The first question I already knew the answer to. That question was, are you thinking of killing yourself? I knew it was yes. The second question was, did you put a plan of action in place? And the third question is, when is that plan going to take place? And I got 3 affirmative answers to all those questions. Had I not accepted, had I kept denying, I could have been in a really bad spot, in a tragedy. But I decided to go to impact, and with the training that I took, and I decided to get my family members some help. Thankfully, everything worked out. That's the power of moving away from denial and going to impact. So we've talked about it in a personal level. You can see how that denial can be very real and very easy to go to because it doesn't match the person that you want to be. It doesn't match the home that you thought you were creating. It doesn't match what you had in your mind. So if it's easy for us to do as individuals, do you think it can happen to us as a community? Have you ever been talking with friends and family or with an organization and said, I'm concerned about this issue, and somebody says, that doesn't happen in my community? Let's be real. Have you heard it in your own community? The job that I do at the hospital gives me the opportunity to see some data that really explains this. And thank you to my community health team for pulling this data. I just wanted to share some of it. Here is the local life expectancy. As you can see here, Barrington, we're doing pretty good. We're at 83 years old. That's life expectancy. To give you some context, in the U.S., the average is 79 years old. Now, I want you to take a look. Take a look at Island Lake. That's 77 years old. For those of you who aren't familiar with the geography here, Island Lake is about a 15-minute car ride from Barrington. That means that in 15 minutes, we're losing 7 years of life. Why is that happening? That's happening because there's inequalities. There's inequalities in economics, in healthcare. We're treating people that look differently. There's a lot of differences and inequalities. And we can't deny those. But perhaps you're thinking, well, you know what? Island Lake is in my community, or that community is 15 minutes away. I challenge you. I challenge you to broaden your picture of community. Because if it's happening 15 minutes from your home or your community, it's going to impact you and those you love. But I'll give you a closer example here for our own community. As I mentioned, working with a lot of nonprofit organizations, we get to meet some incredible leaders. And a lot of the times what I try to do is try to bring those leaders into the hospital, in the places where I work in the past, so they can teach us what they've learned. Did that with Good Shepherd and brought Sam. Sam is the executive director of Rahab's Daughters. For those of you who don't know, Rahab's Daughters is an organization that works on human trafficking. And she talked to us, and quite frankly, she was giving us some of the most horrific stories of human trafficking. And she talked to us about how she goes all over the nation, she goes locally as well, to talk about human trafficking. And eventually, somebody stands up and says some iteration to where do we need to go in order to make an impact in the lives of these victims. And she says, right here in your community. And she did that in our community. And she said, and somebody stood up and said, that doesn't happen here. Well, what people didn't know is that Sam's not only the executive director, Sam also happens to be a victim of human trafficking. And she was able to say, I know this happens here because I was brought here as a victim. So it's happening. It's happening in all of our communities. And there's different issues all throughout. So you're asking yourself, how do we make an impact? Well, before we get to impact, I want to stop at intent. And while I can try to explain intent, I figured I'd just use an example. Here's where my props come out. Here's my prop. Seen one of these? Food, right? Food drive. Who's been part of a food drive? All the hands here are going up. Hopefully, virtually, your hands are going up too. It's a wonderful event. makes you feel good. If you're doing it with your school or your church or your work, makes you feel good to be bringing food to the people in your own community that are hungry. Lots of us do, this one thing where you were in a food drive. I can tell you I did this. I'm in a Condell Medical Center where I work. One of the places where I work is doing a food drive. So I went home, I went to my pantry, and I grabbed this can of soup. I went and grabbed this can of soup because this can of soup has been in the corner of the pantry since I moved in, which was about 5 years ago. So I went and grabbed it, and I was going to donate it. I'm going to show you this picture. This picture was a picture that my friend Bill Ike is the executive director of the Crystal Lake Food Pantry. This picture was taken 2 weeks ago, October 2021. What you see here is an expiration date of October 26, 2009. That means it expired 12 years ago. For those of you who aren't up on the shelf life of a can of soup can live on a shelf for 5 years. That means that that particular can of food potentially could be 17 years old. Now I ask you this. When you go to your pantry and pick up that can of food in the corner, are you doing it because you want to feel good or because you want the person receiving it to feel good? That's intent. So how do we get to impact? How do we get to impact? The first thing that I would tell you in order to get to impact is be informed. And I'm going to share a tool that I don't think too many people know, and that is a community health needs assessment. Each one of our hospitals, nonprofit hospitals, has to create a community health needs assessment every 3 years. Here I'm showing you the one for our community hospital, Advocate Good Shepherd Hospital. If you use this link, you can get to any of the Advocate Healthcare community health needs assessment in Illinois. But the reality is if you go to Google and you type in your own local community hospital, it'll come up. If you want to know what's happening in California, type in Kaiser Permanente Community Health Needs Assessment, and it'll show up. And that gives you pages and pages of what's actually happening in your community. So you're informed. And perhaps there's something from that particular report that connects to you. The other type of research is a little bit more difficult. Perhaps what you need to do is do some internal research. And do research on what that denial point was for you. Perhaps it's mental health in your home, like it was for me. Those are passion points that you can also connect to and go from that denial point to that impact point. The second thing you need to do after that is, once you have the research and the data and the passion point, do something about it. Don't just sit with the information. You can go to organizations that can tell you a lot of different nonprofits that are doing great work. In Barrington, we have the Barrington Area Volunteer Connection. If you go to the county next door, we have McHenry County Volunteer Center, and I'm sure in your community there's particular organizations that can tell you a number of nonprofits. They're working by issues, by locations, but look for one that you connect to. But when you connect to one, I just want you to remind you of the can. Intent. When you're about to make a connection with that nonprofit and you're going to donate, don't donate the 17-year-old can of food. Perhaps you donate the same healthy food that you would feed your own kids, your own families. As a matter of fact, what I did after I picked up this can, and I'm not proud, but this can is 5 years old and about to be expired. What I did is I went to the store and I bought gluten-free pasta. Why? Because my daughter has a gluten intolerance, and I want that person picking up some food at the food pantry that has the same issue to go, wow, somebody was thinking about me. That's impact. When you're volunteering for an organization, you're looking for that organization to volunteer for, I also urge you, perhaps you want to be a board member. That's great. Don't be a board member by name. Go to meetings. Be involved. Make sure that you're looking into your own talents so that you are adding to that organization and making an impact. So what I'm asking you to do is a simple thing, to stop, to think, and to act. So that you can move from that denial place. Don't pause at intent, but really, let's make an impact on our communities. Thank you.